Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. So welcome to Office Hours. And as a bonus, in January 2025, I'm doing office hours every day on YouTube Shorts as well. So please keep the questions coming. You can leave a question on this video, on another video. Your questions are always so good. And I'm going to keep that up for the rest of the month. So thank you so much for sending them in, and let's get started with today. And as always, as a disclaimer, I can't answer personal medical questions because I'm not your personal doctor. So if your question does lean a little personal, I might change it so it's more broadly educationally applicable. So with that said, let's get started. First question today. Such a good question. How to set a realistic, healthy goal weight, especially for seniors. What do you advise your over 65 patients? I have a small frame, female age 68. When I look at my weight, when I look at my height, 5'4" for a small frame, it's 108 pounds. I'm currently 133. My doctor suggests going down in 10-pound increments to see how I feel. So far, I've lost 25 pounds. I'm on Wegovy for weight loss. Okay. That is such a great question. And yes, I think especially for patients who are on the medications and maybe are in their 60s, 70s, and beyond, they may feel like their goal weight is different. So I think, this is an area where the BMI kind of falls short sometimes, because I think overall as a measurement, BMI is a nice starting place, but of course we all know it doesn't tell the full story. It's very one-dimensional, but it's a good place to get the conversation started and go from there. And the same is true with, the number on the scale, right? It's a good starting point, but it's not the end goal or necessarily the whole story. It's only telling you the gravity's pull on the mass of your body. So basically, what I like to do if I'm figuring out somebody's, where we're looking for their goal is I always like to start with where do you want to be? So some people, their goal is they want to be where they were, around where they graduated from college. Some people want to be where they were after they had their first child. Some people want to be just 20 pounds lighter. It's very different for everybody, and that helps me figure out kind of the game plan, and also gives me a starting point in terms of what I think. Where I like to start, I like to take a weight history, and I like to talk about where your weight has been throughout your life, because that, to me, that's very important, because we as humans, we come in a variety of shapes and sizes. And I made a whole video about this before in terms of like dogs and humans. And, there are some people who are a Saint Bernard category, and there are some people who their whole life they were a Chihuahua, right? And so we don't want to have somebody try to shoehorn their way into one type of body when, traditionally they've always been a different type of body. So I really like to also respect someone's genetics and heritage and take that into consideration as well. In terms of the goals that we are looking at. So if I have a patient coming in and they say, okay, like what would be a good place for me to be at? I'm always going to look at BMI, what is a BMI of 24 going to be for this person? But also what was their weight history? What has their weight done throughout the years? And that's going to be very important as well. So somebody might say, well, I want to be the weight that I was in college, and they might actually not be that far from it. So it's not necessarily that the length of time from that goal means that it's unreasonable, right? It really, everybody's coming to their weight from a different place. And it's not necessarily like the passage of time doesn't mean anything. I think traditionally, in terms of, going down by so many pounds and seeing how you feel, there's also a lot of validity to that, because people are going to feel different at obviously feel different at different weights. And if somebody feels like very tired and cold at one particular weight that they thought they would feel much better at, like, that's really good to know as well. And then of course, you also want to take into account the habits that you're putting into place, because that's going to be building the muscle mass, making sure somebody's eating in a healthy manner. So that plays a big role in the weight loss journey as well. So, and that, especially with muscle mass, that really can affect BMI as well. So for me, it's really not like one number. It's a ballpark, taking into account generally accepted medical principles, as well as the weight history of the person, what their goals are, and how they are functioning at a particular level. So it might be that their BMI is a little bit higher or lower than we originally planned for, but that's fine, because they're also like hitting the gym 5 days a week, and their eating is totally different, and they're so much more active than they used to be. And so that number just becomes a key part of the information, but it doesn't give you the full picture of how this person's quality of life has improved, how their health has improved, how cardiovascularly fit they are. So so overall, this long way of saying that the BMI, or the number on the scale, is a good jumping off point, but those are all the things that I am thinking about as well when I'm taking into account somebody's goal and setting goals, when I'm taking into account where somebody wants to be. Also, just as a follow-up note, I think it's also important to think about where is appropriate. Where do we think the medication is going to get them in terms of total body weight loss as well? So, if somebody wants to lose 100 pounds, we know that only a percentage of that is going to be from their tirzepatide. So that's a good thing to keep in mind as well, in terms of how. Obviously, I would love if all the weight loss always comes from lifestyle changes, but of course, we know that's not always possible for people. And so, thinking about the goal and what we know the average weight loss is for these medications also helps give you a ballpark as well. So we usually agree on some sort of number, but for me, as a physician, it's certainly not set in stone, and it's very subjective depending on all those factors that I just went over as well. So thank you so much for such a great question. Next question. I've lost over 3 stones since August, and I didn't experience any side effects until the 5th month when I started getting acid reflux. However, since I've had GERD before, I'm not entirely sure if it's related to Mounjaro. That said, I suspect it might be because last week I delayed my injection until the 9th day and started feeling better, and now 2 days after my latest injection, the reflux has returned. Thankfully, I have less than a stone to lose, so I'm hoping that reducing the dose will improve the reflux. Despite this, I have no regrets. It's been life-changing for me. Their cholesterol has dropped. They're excited to see if it's improved even more. Great. Congratulations. This sounds amazing. Aside from the GERD, sounds like you're doing really well. It looks like you're on Mounjaro. So I'll just talk about GERD more in a more educational perspective, because I'm not your personal doctor. But I will say that, certainly reflux or GERD is a well-known complication of these of the GLP-1 medications, and a lot of that has to do with how the medications work. They really slow the movement of food through the stomach, and if you have more food in the stomach for longer, you also have more possibility that it's going to go back up the other way. And so if you are someone who is prone to GERD to start with, you might find that it gets worse as you start this medication, or as you might come back around later as you escalate the dose. Some people also find conversely that as they lose weight, their reflux improves, especially if they get reflux at night or overnight after a meal, because as they're lying down, there's just less weight in their abdominal cavity to exert force on the stomach to kind of push the food back up through the GI tract. And so it might get better, it might get worse, or it might get worse and then get better. So if somebody is having reflux, if I'm treating somebody who's having reflux, of course, there are great medications that can be used ideally temporarily, like a proton pump inhibitor like omeprazole or pantoprazole. And sometimes I will also add like a Pepsid at night, depending on what the reflux situation is like. But I also am usually pretty hopeful that the reflux will go away with time. It's definitely one of those symptoms that I've seen people, like maybe it bumps up when they go up on a dose, and then a month, 2 months later, it's really not there anymore. So that's definitely something to watch for. And if it's really intolerable, sometimes you have to play around with things and try different medications, combinations in terms of anti-reflux medications. And sometimes those just stay to make things more tolerable. But there are definitely options if it's not going away. And then, of course, talk to your physician. Sometimes people need to see a specialist. But all this is to say that if the GERD starts, it doesn't necessarily mean that it will continue, that it's here to stay. And a lot of times it does go away. So keep an eye on that for sure. All right, next question. I'm 5'9", 245 pounds. I want to be down in the 180s comfortably. I feel pretty healthy and fairly active through work and weekend activities. All I do is gain weight. Is GLP-1 a good option for me? Well, I don't know, but I will say, because I'm not your personal doctor, but I will say, I do think that the GLP-1 medications are a great option for people who really have optimized their lifestyle and really have it where they want it to be. So if someone comes to me and they say, hey, listen, I'm doing all the things that I want to be doing. I am eating just how I want to eat. I feel like it's really healthy for me. I am exercising how I want to exercise. I can't really see the other changes I can make. And yet my BMI is not where I feel like is healthy for me. And we have a discussion and we think, wow, yeah, we really would be expecting your BMI to be lower, looking at your weight history, looking at your actions. That's always, I think, a patient that does really well on the GLP-1 medications, provided they're a good candidate. But I feel like the people who have really optimized the lifestyle changes tend to be very happy with the results because they're really doing everything that they can do. So I can't say if it's a good fit for you. So definitely find a physician near you who's comfortable prescribing it and can go over all, your particular history. But in general, that kind of category of patients, I think, tends to do very well on these medications. Great question. All right, next question. I was on Zepbound for a few months and developed thyroid nodules. I had an ultrasound and a biopsy, which is benign. I stopped using it even though my doctor said I could still take it. I never had thyroid issues before and no family history. So it makes me feel like it's from the medication. I had great results with Zepbound and I'm sorry to stop taking it. I asked my doctor for something else I could take and was prescribed phentermine. I've not started it yet, but plan to. Any tips to be successful with it? Are there concerns with thyroid issues? Okay, so a couple questions here that I will address in a more broadly educational manner. So just in terms of thyroid issues and the GLP-1 receptor agonists, the only real hard stop is if the patient has a personal history or a family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2, because in rodent studies, there was a question of, does this increase the risk? And this is a very particular type of genetic thyroid cancer that we are talking about. Of course, if somebody has thyroid nodules that are being actively worked up for a potential cancer, that's not somebody that I would feel, if they need a biopsy, somebody I'm not going to be starting a GLP-1 on, because I really want to know what we're dealing with before I start them on anything. So that's certainly one thing that, I would also pause on. Another thing to consider is that thyroid nodules are, a small percentage of the general population just has them. And usually they're benign, of course, not always, but it's not, they're not like extremely, extremely rare. It's, these things that our body makes. And, usually they're just these little things that we find. We make liver cysts, we make these little kidney cysts, we have thyroid nodules and thyroid cysts. Like our body, like now that we have all this imaging, right? We can see the things that our body makes that we didn't know that we had, but now we know that we have them, so we need to follow them. So that's kind of a side note in terms of, surveillance now, in terms of, what we have available for imaging and kind of the obligations that we have for these, what we would call incidental findings. It's like maybe you were getting a chest x-ray, and then, they also saw this lung nodule. And so now you need to follow the lung nodule too, because we didn't know that you had it, but now we know you had it, and we still don't really know what it is, but we have to keep an eye on it. So when we look for things, sometimes we end up finding other things. And of course, I'm not your personal doctor. I don't know how this thyroid nodule was discovered, but all this is to say that thyroid nodules as a whole are not extremely, incredibly rare. And a small percentage of the population just has them. And oftentimes they're benign, not always, and you do need to work them up, but they're not like the most rare thing to be developed in the human body. And it's not something that I would expect the medications to be causing. It's not something that if I'm starting somebody on one of these medications, it's not something that goes on my checklist in terms of, okay, now we have to screen your thyroid all the time too. So, definitely have a conversation with your doctor if you're concerned about thyroid health and, what that might look like if you did start back on the GLP-1. But I have patients who have thyroid nodules and are on GLP-1s. And as long as I know that the thyroid nodules are not concerning and we are keeping an eye on them, for most of my patients, it's not something that I would stop the medications for. I'd look at them very separately. In terms of treating a patient. So there's the GLP-1 and there's the weight loss, and then they have this other issue of thyroid nodules, but it's not something that I have to start looking for if I have somebody on one of these medications. And the same is with phentermine. If I started somebody on phentermine, I'm not then actively looking at their thyroid for nodules. I am keeping an eye on somebody's thyroid if I know they have thyroid nodules, but that's not really, it doesn't really have anything to do with their weight loss medication, as long as I know that in the past it was nothing to worry about. So that is a really good question about the nuances of thyroid nodules. People have a lot of questions about thyroid nodules when in clinic, actually. And if they had it, or if they had a family history of Hashimoto's or Graves' disease or things like that. So definitely, if that has come up for you, go over it with your prescribing physician, because you do want to make sure there's no family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2. But that's going to do it for today. Thank you so much for watching. Go ahead and subscribe to my channel if you're not already subscribed. It's the place for medically based answers to your weight questions. And then for all of January, I'm doing an extra question every day on YouTube Shorts. So please feel free to send me more questions. And of course, I will be doing the office hours every week regardless. But thank you all for your wonderful, thoughtful questions. If you want to work with me directly, I will leave all that info down below. For people anywhere in the world, I work on the non-medical aspects of their weight loss as a life coach as well, addressing the non-medical habit-based issues that go along with weight loss is so important and very helpful for people in terms of their weight loss journey. And so if that sounds like you, or if you're someone who's thinking, I want to start a medication, no, wait, maybe I want to try this on my own first. If you're kind of going in that spiral, we can definitely talk. So I'll leave that info down below. Thank you so much for watching, and please be well.